right, good morning. We are live. Welcome to Seinfeld, your final Seinfeld. Unless you become my resident, and you've got 4 more years of this. Um, Today's focus will be on the chicken roaster. So where would you like to start?
We can start with Kramer kind of craving chicken, and it, like, I guess representing his like addiction. I guess that was like the psychiatry parallel that I found. He was getting very irritable. He kind of was doing anything he could to get his hands on chicken. He was lying, and those are all like characteristics of someone who could be addicted to drugs.
Yeah.
So, you know,
Yeah, and even your initial observation, the craving is something that as of 2013 in the publication of the DSM-5 has been added to the definition of a substance related or use disorder. Chicken here being the metaphor. Anybody know if chicken has as high a content of tryptophan as turkey? I know that turkeys. We're gonna look that up.
Yeah.
As I saw the face.
Yeah, because I was thinking, what's the rub? Like, what do they put in that, like, batter and stuff that makes them so addicted to it?
Yeah. But yeah, there's a strong metaphor here. And the other thing about Kramer, and now having discussed him for about 5 weeks, is that he does have evidence, or he does demonstrate evidence of substance use disorder as well as non-substance use disorder. So from that perspective, from that kind of outline, what are the two current non-substance related disorders published in the DSM? Yeah.
Yeah.
So internet gaming disorder, it's in the appendix that's going to make its full text. And gambling disorder, yeah. Yep. Now, we already know that, and I don't know if I actually assigned the specific episode, but Kramer, in fact, does have gambling disorder. There's at least 3 or 4 episodes in which it's fairly straightforward that he has gambling disorder. Yeah. And then there are subsequent episodes where he has caffeine use disorder, as well as nicotine use disorder. All right. So this is a character more than any of the other, at least core characters, that demonstrates substance-related disorder. And here we are again, now a little bit more on the metaphorical side, the symbolism. Do we have an answer?
Yeah, it is high.
It is high in tryptophan, okay.
Chicken, turkey, red meat, pork, tofu, fish.
All right. So given its tryptophan content, can we narrow down the metaphor a bit? Which tryptophan a precursor for? Serotonin. And what drugs hit the serotonin receptor?
Like that.
Yeah, amphetamines, right? Especially methamphetamine, right? And MDMA. Yeah. Yep. Yeah. Yep. So, again, nice, albeit cursory review of the substance-related disorders, including the substance use disorders. So in addition to, and here, insert previous episodes here, caffeine, nicotine, and even gambling, we have maybe the empathogen, MDMA, ecstasy, right? That serotonergic quality of MDMA, for example, allows people to have this sense of belongingness, which is so anti-Kramer in terms of his being able to connect with people due to his personality, and maybe why the predisposing condition to his using something like MDMA, ecstasy. Anything else here?
What did you think of, like, the fact that he was somewhat more, like, quote unquote normal, not living in the department, and then Jerry kind of became more like Kramer living in the department? And what this, if there's like what kind of environmental factor and how he acts and responds to the world?
Yeah, big time environmental factor, right? I think this piggybacks our discussion from last week, and that is for people who have sleep disorder. There's 2 things to consider here. Number 1 is proper sleep hygiene, and how much did his immediate environment, his sleep environment, contribute to his insomnia. And then because we really don't know Kramer as having had insomnia. Right? But I think it's reasonable to assume, especially from a clinical perspective, that if Jerry is subjected to insomnia, if he develops insomnia by switching apartments, then Kramer may have had insomnia all along. And what can insomnia do as it being an independent risk factor? And I think the connection between that and the behavior that we've long observed in this character is certainly a subject for discussion.
Think of like the nuts into the hypothesis and the environmental hit and how, I don't know, like the red light as well, right? That's kind of representing the extremeness of his environment. It also makes me kind of think of like and how the right environment. I've heard too that you do need 2 hits, but if the one hit is strong enough, that's also okay. And this, I guess, the lighting in the situation, you think of that.
Yeah. And then that works, that works for both variables, right?
Yeah.
So if we'll call it as an example of genetic predisposition. And sure, the 2-hit hypothesis, I think, was primarily conceived in relation to schizophrenia, but it can apply to anything and any normal behavior too, not just the abnormal, not just the mental disorder. But if that genetic predisposition, that initial hit is so strong that yes, even without a significant environmental cue, the individual can manifest said behavior. Similarly, with limited, modest, or no genetic predisposition, if that second hit, that environmental stressor was significant enough, you can reach the same exact behavior, normal or abnormal. So 2-hit hypothesis, but either hit could be sufficient to result in the observed behavior. Like again, here, I've said this to the folks that are following us from home on Zoom this morning, so I'll say it here. With 0 genetic potential to develop psychosis that is sitting around this table, give me 24 to 48 hours, and there could be a full-blown psychotic episode given the amount of environmental stress that we could actually induce here. Not that we would do that between 9 and 5 because we have patient care to focus on. But boy, at 5 o'clock, that second hit could be something that, irrespective of the genetic potential, can result in psychosis.
And the sleep factor that is interesting too, and like for example, one of the girls who are without homes, who don't get much sleep because they're like can't protect themselves, or like trying to find places to be. So often some of the symptoms you see, like someone on the environmental illness, is mental environment too. I think it's easy to not forget that, but people often do a lot better in the hospital because they're actually sleeping often more opportunities.
Yeah, and that's one of the hazards, and certainly challenges of healthcare, behavioral healthcare, is that when as you're being in the role of provider, you're discharging the patient back to their pre-admission environment, and you really have little control, not only over the referral back, but in really inducing any significant change in that environment. Right? And we see this a lot with child adolescent psychiatry, especially. But you do have to keep that in mind. You have to have that level of empathy. By the way, just as a quick, it's Friday, so I don't know, maybe you guys do have, in fact, more time to watch films, but Donnie Darko is the, I think, single best movie to focus on someone with almost 0 genetic predisposition, who, given the task at hand, has really nuanced that schizophrenia. And so just belaboring that point, certainly emphasizing that point. The movie to watch there would be Donnie Darko. And by the way, if you haven't seen that film before, you should be watching it anyway. It should be on the short list to view anyway. Anything else remaining for Kramer? What are the characters you want to discuss this morning?
It's not really the main character, but like Peterman, I thought was really interesting. And you come to Burma, apparently he's like a warlord / poet now. And yet Elaine like tracks him down to the middle of like nowhere, and he almost has like, it's almost like he dissociated from his life, like seeing her there really sees himself like really blue. And I was just like wondering about like the characterological thing that led him on this journey to this point where he put Elaine of all people in charge of his company. and like exactly doing nothing.
Yeah, any thoughts about that? So again, maybe we take some of the um teaching points that were previously focused on Kramer and kind of fold them over to the case of Peterman here. This two-hit hypothesis, what might be that initial hit that predisposed Peterman to adopt this new persona as a warlord slash poet? No? So again, cheating a little bit because of previous episodes that cast this character, which again parallels psychiatry and psychology. And as much as we do ask about a past psychiatric and even developmental history, this character has an element of narcissism and egocentrism. Egocentrism is the lighter form, the norm, especially when developmentally appropriate. But he does cast that. He does personify that and depict that, albeit in previous episodes as well. So we see something sustained, meaning that it might be a character trait. That likely predisposes to what's going on. And we can even tell in the workplace. So we see this across settings as well. He doesn't turn this on and off, given where he's at. So at work, outside of work, he's the quote unquote same person. And there's the element of narcissism, even though at this point, we might want to just be careful of not reaching that threshold just yet of narcissistic personality disorder per se. Then something must have happened. And I'm not sure this episode may or may not have captured what that second hit would have been, that trigger, that precipitant. But when we put those two hits back to back, we have this person ending up in Asia.
Killing people apparently.
I think it's like good to know the concept.
Yeah.
It's unstable because we don't know that just from watching the one episode, but I was like thinking about like dissociative identity disorder.
Yeah,
If
like
I
a
didn't know
or
that.
something like.
Yeah,
Yeah.
but knowing that.
Well, again, I think that's part of the discussion, that I would start with some dissociative disorder and maybe dissociative amnesia with fugue. Right. He's assumed a new identity. Now, I don't know if there's a distinct personality state that is truly kicking over his conscious awareness, because if so, then it's DID. But at the very least, we can discuss dissociative disorder or dissociative amnesia with fugue. He has assumed a new identity upon traveling away from his home, and it seems to be textbook there. Yeah. So, and again, to the extent to which a pre-existing condition, a predisposing factor may have contributed is worth the discussion. Okay. Now, I think it's part of darkness. I might actually get the novel wrong, but certainly the screen adaptation Apocalypse Now was referenced here. And in that film's character, narcissism, right? In addition to these narcissistic traits, we see some antisocial personality traits as well. And here the emphasis will be on traits, because there's no evidence whatsoever that Jay Peterman has a child history significant for conduct disorder. Right. So again, for your exam for shelf purposes, no diagnosis of antisocial personality without the individual having been diagnosed with or demonstrating traits of conduct disorder prior to the age of 15. We don't get that from Peterman at all. Now, it's only because we don't know him. We never asked. But anything else with Jay Peterman? Similar to Kramer, we do know he has a past medical history significant for opioid use disorder, right? Meaning that he has opioid use disorder because that's a chronic condition and you don't lose the diagnostic label when you're sober, right? Now that's a different episode. And I'm blanking, but I can't pull it out of the air, but his character does parallel Kramer's in that respect. Now Kramer, not opioids, but Peterman, yeah, opioid use disorder. So might be something there.
Quite an interesting combination too, because it's similar, but the result is so different. And I think part of that is able to money, but it's also be that like the characterological development of his behaviors and personality. So someone who can be successful in some ways. Like you see that sometimes it has some personality traits, or sometimes those traits can actually help
Oh, yeah, he's a CEO and founder, right? And, right, so maybe there's some sublimation here. As a defense mechanism of these, or related to these both narcissistic and antisocial traits, resulting in his opening up this catalog and being a self-made millionaire, right? So, whereas Kramer, who, by the way, has his character completely defined as other. I mean, what do we know about Jay Peterman? Or what's the first thing we would think of when we're describing Jay Peterman? Well, we only know him through his work-related efforts, right? That's it, period. Right. What do we know about Kramer? He hasn't worked for 9 seasons. I mean, there's one episode where he goes back to work, having learned that he's been on strike for years, right? But Kramer's character is literally defined as just not working. There's an episode and there's a scene in which Jerry is talking with George, and George makes reference that this guy, never worked, backs in the money. I mean, his whole life is a fantasy game, right? And those choice of words, I think, are right on target, because where Peterman may be employing sublimation with regard to his narcissistic and antisocial traits, fantasy is probably the defense mechanism employed by Kramer. And you can see 2 very different characters here, although they do share substance-related disorder, one opioid, the other caffeine and nicotine. I got about less than 5 minutes left. Any other observations, any other characters you'd like to discuss? By the way, I mean, opioid use disorder, shelf exam, somebody presents with where opioid intoxication is the single best answer. How will that case vignette look?
Pinpoint people,
Right, slurred speech, pinpoint pupils, decreased respirations, even coma perhaps, right? I will tell you that greater than 50% of the time on shelf exams, the individual with that same single best answer, opioid use disorder, or perhaps even opioid overdose, will have dilated pupils, right? And that might be given in the first sentence to throw you off course, throw you off track. What is the opioid that dilates and doesn't constrict pupils? And even though in clinical practice, it's a relative rare occurrence, on shelf exams for this very reason, it's paradoxical effect, you're actually more likely to see it. Yes, meperidine. And do we know why? It's because of the anticholinergic side effects outweigh the opioid effect. Right, so the muscarinic effect, the muscarinic receptor here is just greater than the opioid receptor, the mu. That's mu, right? Mu. Or is it a U? You know what I mean?
Yeah.
All right. So meperidine or Demerol will dilate and not result in constricted pupils. Good. Opioid withdrawal.
Like symptoms, yeah. Interesting about opioid withdrawal is like what I learned can actually kill you, unlike alcohol withdrawal, which binds the same receptor, which can kill you. But yeah, GI issue is failure.
Yeah. So any patient that presents with the flu on a psych shelf is opioid withdrawal until proven otherwise, right? So, and it's right, it's not life-threatening, it's horribly uncomfortable, but it's very often not life-threatening like alcohol or benzodiazepine withdrawal. What is the one clinical situation, and I don't think you'll be, I can't say that, but not likely to be on your shelf exam, but in clinical practice, you have to be well aware of it, where you would be concerned of withdrawal from opioids. Pregnancy. Right. So we would recommend continuous fetal monitoring. And usually we recommend methadone maintenance through the pregnancy and not methadone taper for the withdrawal because of the potential hazard effect on the unborn baby. It's the only clinical situation. All right, that brings us to almost the bottom of the hour. We have about 5 minutes to or until our next didactic, so we'll log off, but we will log right back on for morning rounds. So thank you.
Dr. Kirby, I have a question about like the methadone